the human metapneumovirus, or HMPV as it's called, with cases on the rise in Asia and some detected in India. Should we be bracing for another health crisis, or is this hype overshadowing the facts? This is going to be critical to discuss as well. To join, we have two of our guests who will be coming in. We have Dr. Ramasubramanian, who's the consultant infectious diseases at Apollo Hospitals, who's joining in. And with him, we will be joined by Dr. Vinit Samdani, Pediatrician at Breach Candy Hospital as well. But first, let me get in Dr. Ramasubramanian. Dr. Ramasubramanian, good afternoon and welcome to the show. How are you looking at HMPV? How dangerous is it? And what are you picking up on it firstly?
Good afternoon. And at the outset, I would like to say that there is a huge, hue and cry going on about nothing. The human metapneumovirus has been around for over 60 to 80 years amongst us. It was identified and named as a HMPV only probably about 25 years ago, but it is believed to have been circulating for several decades before that. It's a virus which is akin to the normal cold virus, which causes a reasonably innocuous disease in most people who are healthy. Probably it may cause a little more severe disease requiring hospitalization, maybe in young kids, in the elderly, and patients with whose immune system is compromised. But otherwise, this is a very, very mild infection in most scenarios. In fact, in adults, it doesn't even cause fever. So this is just an unnecessary, I would say, cue about something which is very, very innocuous and trivial, which has been around for a long time.
Why the hype? I mean, why has it suddenly come to everyone's notice right now?
I think I should ask you that question. It's the media which is creating the hype, and I don't know. Especially, I think China looks like a very, very, exciting place where things have gone wrong in the past. So people tend to associate it with this. But speaking to several colleagues in China, there is nothing untoward happening. What they see is the normal prevalence of this infection, which happens every winter. Usually, influenza overshadows it by several times. You may have other viruses like the respiratory syncytial virus, the rhinovirus, this virus. All of them can sometimes cause, combined infection and cause problems, but nothing untoward this year at all.
Okay. So what are the symptoms and signs of severity that should be taken care, if at all it impacts?
Usually, this virus can cause a little bit of a nasal congestion and blocked nose, a little bit of a feverish feeling. In fact, adults, as I said, don't even usually have fever. But what you need to watch out for any viral infections, because you cannot differentiate this from the influenza, from the RSV, from the rhinovirus, or even the COVID. So if a person starts getting a little breathless, if the person has difficulty breathing, if he's running high fever, this definitely warrants checkout and probably hospitalization if the oxygen level is low. If the person is immunocompromised, an elderly patient with several comorbidities, including diabetes, heart disease, lung disease, or kidney disease, then probably you need to definitely have it checked out with the doctor.
Okay. How is HMPV different from RSV? Because RSV was also doing rounds, in between. So firstly, how is it different? And taking into consideration that this virus was prevalent since very long, is there already a vaccine or something that is in place?
Like RSV, this is also a respiratory virus. The transmission is similar to COVID through aerosols. So somebody who has the infection coughs or sneezes through the aerosols, this virus can spread and contaminate the surroundings, and somebody touching it and taking the hand near the face can get the infection. Very similar to flu or COVID. Because this is a very mild infection, both investigative modalities to identify the virus has not been very, very, robustly done in India. Only when in the last few years we have come up with the respiratory viral panel, which includes a host of about 7 or 8 viruses, this is being picked up. And even last year, even in our hospital, we had probably over 50 or 100 cases, where we picked this up. So this is nothing new. And because this is a reasonably innocuous virus, there is no vaccine available, only preventive measures, which include hand hygiene, distancing, and probably you need to cover for flu, because if a person gets flu and this and another virus combined, it can sometimes cause in the elderly serious infection. But RSV, the only way different is a lot of people who developed wheezing, especially the elderly or children, you need to suspect RSV. In a non-wheezer, if they develop some wheeze, we think of RSV. This metapneumovirus can you can get attacks of worsening asthma in people who are asthmatic, but otherwise it doesn't typically cause wheezing in the elderly.
Right. So would it be right to say that HMPV can cause outbreaks, but it's not an epidemic or a pandemic?
No, it is typically associated with the winter season. So in countries where they have a cold winters, this is seeing more often in the winter. So you definitely get an increased number of cases in winter. But other than this, it is not something I would worry about, at least definitely not at this point.
Right. Thank you so much, Mr. Ramasubramanian, for joining us and clarifying this for us. In fact, let me also now welcome in Dr. Vinit Samdani, Pediatrician at Breach Candy. Dr. Samdani, firstly, welcome to the show. How are you looking at HMPV? Because doctors are of the opinion that this is not something that we should be worrying about, but yes, precautions need to be taken.
Hi, Hiral. Thank you for having me on the show. But exactly. So HMPV has been there for a long time. The first case detection documented was in 2001 in Netherlands. So this is predominantly in the winter season, and the presentations are cold, cough, fever, and if little wheeze. But otherwise, I don't see a concern. This is a normal winter virus, and this will pass by for sure. The only other thing that I see with HMPVs are they are usually co-associated with some other viral infections that may be there. Otherwise, I do not see a concern or a panic or anything for us to worry.
So the cases which have been detected so far, Dr. Samdani, in terms of India, the key is it is children below the age of 5 who are mainly at risk. What is it that you would actually advise in terms of precautions?
So precaution is going to be a distance of 6 feet, wear a mask. That's the preventive precautions of COVID that we continue. But this is a normal ongoing virus. I think the minute the kid goes to school, there is obviously a chance of one getting a viral infection. This is no alarming symptom of HMPV for us to be worried. It's not going to be the 2019 variety of COVID where we need to panic. So hand washing, sneezing, put your hands over, while coughing, prevent droplet infections. And the droplets are obviously, these are large ones. These are not minute that's going to be easily transmitted. So I'm not worried about this virus at all.
So is it going to be the usual mucolites and levocets of the world that is going to do the trick for all these children in terms of treatment, and no majors that would be required then?
Perfect. Hiral, you perfectly said it. It's symptomatic treatment. Yeah, Crocin for the paracetamol for the fever, a cough syrup if required, and if it's cold, an anti-allergic and symptomatic, a very small percentage may give us issues of wheezing, where we would need to address depending on the clinical symptom and the X-ray. Otherwise, I don't think there should be any other concern.
So very lastly, this could be an outbreak, but not a pandemic or an epidemic. Would it be right to say that?
So history says every 100 years you have a pandemic.
So we're still far away from the next one then.
Correct. So there is no panic. I think it's just an ongoing viral infection that will keep coming and going seasonally. Nothing to worry at all. It's a winter break viral infection.
Right. So this is an interesting conversation. Thank you, Dr. Samdani, so much for joining us on the show and sharing your views. But clearly, HMPV, a regular virus, nothing that one should be worrying about as well. In fact, with the HMPV virus headlining most news outlets, ministers have also been trying to assure the public of safety and the need to not panic. Exactly what the doctors are indicating. In fact, Health Minister JP Nadda issues a statement saying that the ministry is closely monitoring the situation and that there is no need to worry. Let's listen in.
चीन में जो HMPV वायरस के मामले पर हाल ही में आई रिपोर्ट्स पर स्वास्थ्य मंत्रालय ने इंडियन काउंसिल फॉर मेडिकल रिसर्च के साथ और नेशनल सेंटर फॉर डिजीज कंट्रोल के साथ और वर्ल्ड हेल्थ ऑर्गेनाइजेशन के साथ चीन सहित पड़ोसी देशों में स्थिति पर कड़ी निगरानी रखे हुए है। WHO ने भी स्थिति का संज्ञान लिया है और जल्द ही वो भी अपनी रिपोर्ट साझा करेंगे हमसे। ICMR इंडियन काउंसिल फॉर मेडिकल रिसर्च और इंटीग्रेटेड डिजीज सर्विलेंस प्रोग्राम IDSP के साथ उपलब्ध सांस संबंधित वायरस के देशव्यापी डेटा को भी समीक्षा की जा रही है.
Right, so that's the bite coming in from JP Nadda as well.